All right, good afternoon or good morning, depending on where you're calling from today. Welcome to the Hiring New in 2022 webinar series with the Centers for Medicare Medicaid Services. We are very excited to have you today. Given our name, obviously the world has changed a lot over the past 2.5 years, and so is hiring. So this series is really designed to talk about all things recruitment, especially as it relates to CMS and our hiring needs. My name is Marla Lazarus. I'm with the Office of Human Capital. And I'm just going to go over a few housekeeping items, and then I will turn it over to our presenters today. The webinar itself is being recorded. It will be posted to our YouTube channel at the beginning of next month. One of my colleagues will post that link in the chat box, so you all have that. There you can also find all of our previously recorded webinars as well. Do want to let you know that a follow-up email will be sent to all registered attendees today. It will include the slides that you'll see as well. If you do have any questions today, feel free to use the Q&A box. The chat will only be able to, we'll be able to give you information, but if you need to ask any questions, feel free to just use the Q&A box. If we have time at the end, we will get to some questions. Hopefully, we'll have time to get to some questions verbally as well. And that is either for our HR colleagues on the line or any of our panelists that you'll be hearing from today. So I'm super excited for our topic today. It is the Presidential Management Fellows Program. So hopefully you are all in the right place. Really excited for our presenters, Natalia Mandel and Shaheen Reed, who are both seasoned experts with the PMF program. And all of our panelists today are either current or former PMFs. So you are really getting firsthand knowledge about this program. So with that, I want to turn it over to our PMF and Pathways Coordinator at CMS, Natalia Mandel.
Thank you so much, Marla. It is a pleasure to be here today. As Marla has mentioned, I am the Pathways Program Manager and Coordinator here at CMS, and we're very excited to be able to share all things Presidential Management Fellows with you all on the line today. Presenting with me today will be Shaheen Reed. He's an HR specialist, primarily purposefully sort of focusing on recruitment and outreach. So Shaheen, say hello to everyone.
Hi, everyone. Thank you, Natalia, for the intro.
Thanks, Shaheen. All right, well, we're going to get right into it. So we want you to know all things about our Presidential Management Fellows Program. You're also going to hear me refer to this program as the PMF program for short. So there's going to be an opportunity later to also ask a few questions. So what our presentation is going to look like is going to cover what is CMS, what is the PMF program and its overview. And you're actually going to hear from our PMFs as well, as Marla mentioned, folks who are currently in the program and those that are part of the alumni community. And then as I've mentioned just now, we're also going to have an opportunity for you to be able to ask questions. So without further ado, we're going to get right into it. And Shaheen's going to go over with you what is CMS.
Hi, everyone. Thank you again, Natalia. So yeah, what is CMS? So for those of you who aren't familiar, the Centers for Medicare Medicaid Services is the largest purchaser of healthcare in the world, and it's responsible for one of our nation's most critical functions. We manage the programs of Medicare, Medicaid, and the Children's Health Insurance Program, also known as CHIP, and the federal health insurance exchanges. The programs combined touch the lives of over 145 million Americans. And consists of about 25 different departments that really support this mission to ensure effective and up-to-date health coverage and to promote quality care for beneficiaries. Go on to the next slide. So we are located, our headquarters are located in Woodlawn, Maryland, which is right outside of Baltimore. However, if you want to go to the next slide, we do have two satellite offices in Washington, D.C. and Bethesda, Maryland, as well as 10 regional offices around the country, as well as an office in San Juan, Puerto Rico. So lots of flexibility as far as locations and localities go. And so this is just kind of to give you an overview of some of the positions that we have here at CMS. I like to kind of categorize the work of CMS or the agency itself into two kind of buckets. We kind of have an operational / business side, which supports our main offices, which is the other side that handles the programs, our external programs like CHIP, Medicare, Medicaid, and the federal exchanges. So we hire a variety of different positions in various fields. As you can see, we have like health administration and policy, media communications, business, finance, and program support, technology, mathematics, and science. We have more to offer than just health insurance. So there's really a place for everyone at CMS, and we really run the whole gamut when it comes to different careers.
Thanks so much, Shaheen.
So I'm gonna,
yeah, that was a great overview.
Gonna pass it off to you.
Thank you. Thank you. So as Shaheen has mentioned, we hire for a variety of positions. And in that variety of positions, you can serve as a presidential management fellow, which is the great part here. So we're going to get right into what is the Presidential Management Fellows Program, how you can apply for it, et cetera. So to start, in 1977, the PMF program essentially was found, right, by President Jimmy Carter. It was part of one of his executive orders to be able to create this. And this program is over 40 years old at this point. So it's been a while since we've been running this, right? So how the PMF program works, and there's a lot of dense information on the slide. So we're going to start kind of picking at everything here. So the application process is rather, I want to say, a little bit longer than other formal processes for application, just because this is a highly competitive program to get into. So essentially, this is for individuals who have completed, graduated, I want to say, within the last 2 years, a qualifying advanced degree. So that could be either a master's degree or a PhD. And they are going to be meeting those degree requirements by August 31st of the year following the application announcement. So for example, we can have somebody that could be applying to the PMF program right now that has not yet graduated. And when I say right now, I'm saying for when the 2023 application period will be open, which is actually going to be in late September. But they're going to be applying and they may have not necessarily graduated quite yet, right? And that's okay, as long as they're going to be completing their program by that end date. So you would be applying to the PMF program to be first what we call a PMF finalist. And you do so by going to usajobs.gov. So typically the pmf.gov website will post the recruitment schedule for every single year. There's only one time per year that somebody can apply to be a PMF finalist on usajobs.gov. So make sure you're checking in with pmf.gov to know exactly when you should be applying and when that announcement will be available to you. Then what happens is OPM selects those finalists. They go through an extensive evaluation, multiple hurdle assessments, their experience is looked over, what they've graduated, et cetera. And as a result of those assessments and verification, they go ahead and issue about 1,000 finalists for the entire year. So again, as I mentioned, very competitive. So once OPM issues that list of finalists to us, then the agencies, CMS included, will be able to go onto an internal talent management system where we post exclusive announcements to those PMF finalists so they can apply to specific agencies and then hopefully deem their PMF status. So from a finalist to a fellow. So those finalists that are going to end up applying and then being selected for certain positions across the agencies that use the Presidential Management Fellows Program will then be appointed into a 2-year position serving on their probationary period in the accepted service. So the biggest perk of this program, in my opinion, is not only the networking, not only the exposure and experience that you would receive, but the fact that you get to non-competitively convert into a competitive service position with a full performance level, grade level of a GS-12 here at CMS. So you could become eligible to be able to do that. So you're really trying to set up your career for the long term here. In terms of program requirements, there's quite a few things here. So you would be expected to attend the OPM PMF orientation. Then we have a separate CMS PMF orientation. You would have to have senior level mentorship required. Then you also are going to be required to complete something that we call an individual development plan, which is really like a journey map of what your 2 years here is going to look like in the Presidential Management Fellows Program. We also require that you do a 4 to 6 month developmental rotation And the good thing about CMS, though, is that we don't limit you. So if you wanted to do your rotation here at CMS, totally fine. We have plenty of PMFs that do that. However, if you wanted to sort of branch out a little bit, maybe go to a different agency in the HHS umbrella, or maybe even go to a different agency or department across the government, you can certainly do that. We actually have quite a few folks that are either in the Office of Management and Budget, Executive Office of the President, the White House office, press secretary's office, congressional committees, and so on. So we definitely don't limit you here, which is a great perk also to be able to enhance your experience. And then last but not least, there's also a training requirement where you're supposed to receive 80 hours of formal interactive training per year, and it's 2 years, right? So that's an aggregate of 160 hours total. So we don't let you roll over those 80 hours. If you get anything extra than that, you do have to do 80 per year. So that's the program requirements over the course of those couple of years. So then we're looking at conversion, that perk I was talking about earlier. So you have to have successfully completed that 2-year continuous service as part of the PMF program. Then you also have to meet any type of agency specific requirements that we have, and that's specified in our participant agreement that you would be signing once you first come on board. You have to demonstrate fully successful job performance, and we do have a rating system here at CMS, just like any other agencies when it comes to performance appraisals. You also have to meet the qualifications for the position that you would be converting out of from the PMF program. And then last but not least, again, I just want to hit you with the fact that you could be converted to a permanent position or a term position, but we typically don't use those. We usually do permanent with a full performance level of a GS-12. So again, really setting up your career structure there. So in terms of, oh, we're skipping a slide a little bit early there. So why would you want to be a CMS PMF, right? So these are kind of the things that I wanted to try to discuss with everyone, share with everyone in terms of what we contribute to the presidential management program here. So there's different types of leadership training that you can take included within the PMF cost that we pay per PMF to OPM. There's actually a leadership development program that is associated with that. And it's at no additional cost. I highly encourage all of our PMFs to take participation in this program. And it actually contributes to well over 80 hours of towards your formal interactive training across 2 years. So it's a great perk to be able to have that as well. There are tons and tons of networking opportunities here. So we actually have one of the largest PMF networks across the entire government. So there's definitely no shortage of PMFs here. And we're also sister agencies with some of the other operating divisions under HHS that have even larger networks of PMFs as well. So we definitely have quite a few PMFs under the HHS umbrella as a whole as well. Then you also have promotion potential. So as long as you're fully successful and you're demonstrating that performance to your manager and there's a need for promotion, you could be promoted to the next grade level while you're in the program. So again, that's that full performance level of a GS-12 that we were talking about earlier. That's a great perk. And then benefits. So PMFs get all the same kinds of benefits and entitlements as a regular CMS employee. So that's definitely something to look forward to. And here you're just going to see a little graphic as to why you should choose CMS if you do become a PMF finalist. Now, some of these things, again, I've already covered, but kind of just to kind of go through and peruse through this really quickly. So we obviously have that conversion and promotion potential that I've already mentioned. Our rotations, again, can be done internal or external to the agency. So we offer tons of flexibility there. In terms of benefits and telework, we're a very, very friendly agency when it comes to those types of things. Peer mentoring is also another thing. Because we have such a wide network of PMFs and folks that have graduated, we love to be able to connect you all together, even if it's with somebody that's already graduated out of the program, so they kind of can help acclimate, to your experience and kind of give you some pointers as you're sort of maneuvering through your first couple of months. Again, touching on that network, we want to make sure that you get access to not only presidential management fellows, but we also have a very large recent graduate and intern program. So across these sort of entry-level leadership development kind of programs, you're going to have access to at least 130 people or so in the program year-round if you wanted to have that access. Visibility is another huge thing for us. We love to promote the work that our presidential management fellows do. So we have a newsletter, a LinkedIn. We want to post and brag about everything that our wonderful PMFs do here. So it is a great way for you to be able to make your name known very early on in your career here at CMS. And last but not least, our mission. We want to make sure that you are committed to the mission once you're an actual CMS PMF fellow. It is an absolute wonderful mission. I know Shaheen has had some great words about it earlier in our slide deck presentation here, but we want to make sure that we are properly impacting the lives of many, many Americans. So it's definitely heartfelt, and we definitely have PMFs here that do just an amazing job carrying out that mission. And down below in our little graphic here, you'll also see a bit of a timeline from 2019 to 2020 and 2021, where I don't mean to brag, but we've had some major milestones and accomplishments, but those are kind of self-read. So you can definitely go ahead and take a peek at that. And I believe that everyone will be getting access to the slide deck. So just want to mention that as well before we turn it over into our discussion. So I'm going to go ahead and ask our panel members, if your cameras aren't on already, to please turn those on so that our audience can see who everyone is. So we're going to have a quick discussion with our panel members that are either current PMFs or PMF alumni. So we have joining us today, Abby Korb, Maya Peterson, and Douglas Block. So Abby, you want to go ahead and say hello first?
Yeah, hi everyone. My name is Abby, and I am a PMF in CCIO, which is the Centers for Consumer Information and Insurance Oversight. And I've been here since May.
Awesome. Thanks, Abby. All right, next up, Maya, I'm going to call on you. I'm just going to go in order as I have you listed here.
Yeah, sounds good. Hi, everybody. So my name is Maya Peterson. A little bit about my background. I am I did spent 10 years in the hospital as a pediatric ICU nurse. And so I am at CCSQ, which is Centers for Clinical Standards and Quality, supporting the front office. And I just started as a health communication specialist a month ago at the beginning of August.
Thanks, Maya. All right, and last but not least, we have Douglas Block.
Hello, everyone. I'm Douglas Block. I'm in Center for Clinical Standards and Quality as well. I'm a PMF alumni now who joined in May of 2020, and I work basically anything related to data at the center.
Awesome. Thanks for sharing. All right, so we're going to go ahead and just start asking you guys some questions. So I'm going to go ahead in order and start with the first question, and then maybe each of you can tell us a little bit about your experience as it relates to each question. So our first question is, how was your application and onboarding process? And you can tell us a bit more about the OPM assessment, because I know there's been a few changes there as well. So Abby, you want to go ahead and start that off?
Yeah, absolutely. So the process, kind of like was mentioned before, is a longer process. It's not just sending off a resume and a cover letter. I think for me, the most difficult part was just getting all of my materials together, since I was still enrolled in my master's program when I applied. So to prove that I would have my degree by the time, by the end of the year, I had to go through the registrar at my university, get special letters saying that my degree would be conferred, and just kind of getting my whole application packet together. And then, yes, there's the OPM assessment. And so I just graduated from American University here in Washington, D.C., and they had a wonderful kind of prep program for us. And so we talked about how to answer the different kind of personality-based questions. And I guess my biggest advice on that is kind of look at some of the practice exams and kind of look at the type of questions they're going to ask you. But honestly, I wouldn't, go in depth and try to answer every single practice question out there. A lot of it is kind of, personal judgment and how you interpret the question. And so looking at any of the prep materials that OPM has, that your school may have, those are really helpful for me when it came to the assessment, which I know they're changing a little this year, but those are kind of my experience there.
Thanks for sharing, Abby. What about you, Maya?
So I am very jealous that Abby knew people who had done it before, because I did not know anybody who had done it. I found out about it through another fellowship that I had done, and so I was able to get a little bit of an insight, but I really didn't. I'll be honest, I didn't really prep for the questions or do anything. Like, I looked at the stuff that's available online, and that was kind of it. I think that the biggest thing I remember was that there was like, I'm a pretty fast test taker, but there was still a time parameter on both the essay and the questions. And so for me, just being like, I remember being a little bit stressed about that. And so like being mindful of the time um, for that. As far as like the application and onboarding, um, we're a group of eager beavers. Like all of us are super excited and super interested. And so I think for me, just really remembering that I had a full year to get an appointment. Like you all think you've got the golden ticket and you're going to like get a job in the next 2 weeks. And that is not what happened. Obviously, I just started in August, even though I had already graduated before I applied. So um, I had to apply, it's just like any other job search. You have to apply, you have to interview, you have to make sure that it's the right fit. And so it took me several months to kind of get through that process. And so I think my advice would be just kind of like remembering that this is a process and it's not like going to be an instant thing. You're going to have to make sure that the job is right for you and that you get seen and network and go to all the events. PMF has a lot of good, office hours, and then they had meet and greets with different agencies and really keeping your mind open. CMS was my first choice and I was lucky to end up here, but I was networking all across the federal government, which I think will serve me when I go to do my rotation, because now I know people in a lot of other places and they've all said, yeah, let us know, when you're ready. We'd love to have you for a rotation. So building that network starts even before you have a job, I would say.
That is such a great point. You're absolutely right. You just want to keep that network kind of building up and ready to go. So obviously that provides for a great amount of opportunity. Thanks, Maya. And then last but not least, we have Douglas. I know it's been a little while since you went through the application period, but that's okay. I'm sure it's still fresh.
Yeah. So for me, so I was kind of similar with Maya. I actually hadn't been really looking at the PMF program. I just happened to come across it while searching for opportunities and threw my application in and it went through. I would say a lot of the questions, it's just kind of common sense and ethics. So I think if you just kind of follow what you would expect or what you would hope a public servant would do in a different situation, you should be okay. In terms of the next step, the application process, once you've gotten in, people do it different ways. I applied to like 60 or 70 different places, probably did 20 or 30 interviews, and then ended up at CMS. So I think that's maybe one point to just recognize. It's not like, oh, I've got the PMF status now, I'll just get a job wherever I want. It will require some work. Obviously, if you're going to do an interview with an agency, you at least need to know on the surface level what they do, not necessarily everything. So I guess just be prepared for that. There'll still be some more effort that goes into it even after you've finished, I guess, the formal arrival to being a PMF, not applicant, I guess, success or whatever the official term is.
Awesome. Thanks, Doug. All right. And I do want to shout out a quick reminder that you can ask questions in the Q&A box. So I know that there has definitely been some questions already answered, but I want to make sure that everyone has the opportunity to ask those questions if they do arise. All right, we're going to get right into our next question for our panelists. So I was about to call you guys finalists, but I'm like, you're already way beyond that. All right, so what type of work do you perform as a presidential management fellow? Abby, I'm going to call on you first.
Yeah, so I think it really depends on where you are. And we've all kind of mentioned that we do different things. So for me, I'm a social science research analyst by title. And so I do a lot of kind of administrative tasks, a lot of emails. My team works on, filings and compliance with the Affordable Care Act. So it's a lot of kind of looking at the marketplace and those types of plans. And I guess that's kind of my day-to-day job. As well as some communications work, but I've also had the opportunity to work on some more like special projects and things that aren't necessarily, weren't things that were necessarily talked about in my interviews, helping kind of with current events, different guidances that we put out. And so it really just depends, I think, on what your title is, but no day is the same, at least for me. Some days it's just emails, some days it's meetings, some days it's trainings and getting to learn a ton of new things that I really wouldn't have expected. So I think the great thing about PMF so far for me is that I've been able to try a lot of different things. And if there's something I'm interested in that wasn't necessarily something my team had in mind, I can bring that up to my boss and she's like, oh, I know so-and-so who works on that. Let me connect you. And then I have another connection made and I get to work on another project. So that's been my experience so far.
Thanks, Abby. Sounds like definitely an exciting environment. All right, Maya, you're up next.
Yeah, so this comes with the huge caveat that I've been here a month, so obviously I'm a total expert in my role. But coming from a clinical background, I support the CCSQ front office, and so my boss is the the deputy chief medical director for all of CMS, and so I she owns the behavioral health portfolio kind of for all of across CMS. So there's a huge push right now from the administration and in Congress to kind of improve our behavioral health and substance use disorder quality programs. And so I'm involved in some briefing documents, the creation of kind of compiling the information from all across CMS, from all the different areas, who's doing what to fit that into the CMS behavioral health strategy. So that's been really rewarding and really excited. They were joking that I kind of jumped in with both feet. So we'll see. I like to keep expectations low, so like I don't want to get too involved in that. But I'm having a good time. And then I'm also going to be working with some of the CMS regional offices, the chief medical officers for the regional offices. On a project related to EMTALA, which is the piece of legislation that allows anybody to walk into an emergency room and get any kind of emergency medical care, whether or not you can pay. And the enforcement, there is a part of EMTALA related to mental health emergencies and crises, and that is very disparate across all the states. So my kind of big project for my PMF time is going to be looking at that and trying to look at the quality measures and see if we can get a good handle on what's happening from state to state.
Thanks so much, Maya. So as y'all can see, there's definitely seriousness when it comes to hiring our presidential management fellows, working for a lot of high profile folks and building a pretty high profile portfolio as well. So it's definitely an exciting pace and environment to be in. And then last but not least, we have Douglas. Tell us about what work you performed as a presidential management fellow.
Yeah, so I've actually been in two offices since I've been here, since I transitioned over to a new office recently. But my initial appointment as presidential management fellow, I did a lot of work related to data visualizations. That was more on the operations side. And so basically, the people who run CMS, our COO and our director, they need to know like what happened with COVID. Like, are people still able to work from home? Because if CMS employees can't work, that's probably a problem for all our programs. So we did a lot of data visualizations with that, building dashboards, identifying problems where they did or didn't exist, like tracking COVID cases to see when it would be safe for people to come back to the office. And then more recently in CCSQ, I've done just a lot more general social science / data work. There's everything from doing a large scale literature review now on health equity, which a lot of you, if you're doing your master's or PhD, that's an integral part of any research. With that, the basic idea is you want to know what are the benefits of rules or programs where you're proposing. Will they work? What is going to be some drawbacks? What are going to be the good things that come from that? And then also I've worked advising on new programs they're looking at, like how you can track performance, writing some papers, which may go out for peer review, so kind of more of an academic sense. So just a little bit of everything related to research when it comes to like any health programs, which CMS touches, which is pretty much all the health programs in the country.
Awesome. Thanks, Doug. All right. So we're actually going to go ahead and kick it off to Shaheen to ask our next question. So Shaheen, the floor is yours. Oh, I can't hear you for some reason.
Sorry about that. I was double muted. Okay. So I wanted to ask, how did you or do you engage with your peers while in the PMF program? Yeah, so Maya, if you would like to touch on that.
Sure. So we have at least the class of 22, the finalists of 22 have developed kind of our own unofficial channels. I take no responsibility for that. I just enjoy them. But we have a Discord channel, and then we have a pretty active LinkedIn. And so that's been super helpful to just, kind of have other people going through the process. We're all really supportive and, oh my gosh, I got an offer. Oh my gosh, I got an interview. Who's prepped with this? Who's talked to this? So that's been really great. And through that, I found out that there was another PMF starting with me. And so I like Zoomed her that morning and was like, hey. And so she and I probably Zoom each other like once a month, once a week to be like, hey, what's this? What's this general thing? She works in a totally different part of CMS. But it's been really nice to even just kind of informally build those connections.
Great. How about you, Abby?
Yeah, I mean, I'm also part of the Discord, and there's a Facebook group. There's at least out here in DC, there's kind of a current and alumni PMF Facebook group, and people are always like, hey, I'm moving out of the area. Here's my house. Like, do you want to buy it? Or like, hey, my agency has this placement. So there's literally so much going on. I think more internally, I know my team has monthly PMF coffee chats. And so we all just kind of hop on Zoom together and talk about everything. And it's nice because there's always new people coming in. And so some of us may be familiar with each other and are able to kind of touch base on projects or things that we talked about previously. And then there's new folks that are asking questions that it's sometimes it's nice to get answers from your peers versus from, more like the higher level technical stuff. And so that's been a really great way to stay in touch with PMFs within my group. And then I know also the CMS PMFs have some more like informal game nights over Zoom. We've had happy hours, just trying to find ways to meet up with each other, especially those that are in the area, if we can do so safely, and just kind of make those connections because it is really hard when you're remote. But I've been so happy with all the different ways to connect with fellow PMFs in general and here at CMS.
Wonderful. Douglas, do you have anything to add?
I think just the only thing to add too is when you do the PMF Leadership Development Program, which also helps you with a lot of your training hours, especially in year one, you do like monthly meetings, it's a small group, about 6 of 8 people. So you connect with a lot of people from different agencies across that. And then in year 2, you do what they call a challenge project, which is basically a cross-agency project that you work on. So again, you're able to meet people that way. So I think aside from what Maya and Abby said, that was kind of like the other main way you connect with people from different agencies and learn what people are doing.
Thank you so much for those answers. So yeah, definitely tons of networking opportunities. We try to set it up to where, all the PMFs are speaking with one another almost on a regular basis. So we use little functions like Zoom and things of that nature to be able to connect everyone initially and then have our sort of unofficial cohort captains. So we actually nominate about 2 to 3 people a year that set up all those types of events that, Maya and Abby were talking about. So definitely a well-built community here at CMS for PMS. So thanks for touching on that. All right, so on to our next question. And I know there's a few in the Q&A that we're going to get to in just a bit after we're done with our panelist questions that would like to be answered live. So there's a particular couple for our panelist members here. But nonetheless, we're going to go ahead and jump right into our next question here. And our next question is, what were some of the training opportunities you've had as a PMF, and were the trainings and our monthly meetings helpful? So I know obviously some of you are here, for a short period of time so far. So we may have to rely a little bit more on Douglas to answer that question. So I'm going to go ahead and start off with you right now.
Yes, I guess internally, we do a good job. Actually, Natalia does a good job since she leads the PMF program here. You have a monthly meeting, and so that helps you, I think, first understand like what training you need to do, what training's available. We always bring in someone else. They have a list of courses you can do. internally to make sure you stay on track with your timeline for the PMF, which is important because you do have some requirements to fulfill. CMS as a whole also has other courses you can do, everything from data visualization to kind of information on diversity, equity, and inclusion. There's just like a wide range of them. You also have your PMF training, which is run, I guess, government-wide, which is included in, I guess, the fee that CMS pays, for you to be a part of the agency. And so, that gets you 80 hours of training. It's really good. And I know me personally, I was able to do some other training through HHS on data science and machine learning, which they had internally. And, most of your supervisors, probably everyone supervising, be really open to doing training. So you have a lot of flexibility if you see something interesting, maybe even if it's outside. If you ask and there's funding, a lot of your supervisors will let you do that and even fund some training if you need to know specific information or program or something.
Great, thank you for that. You're gonna make me blush today, don't do that. Thank you for the nice words about our program. All right, so next up, I'm gonna go ahead and call on Abby and then Maya to sort of finish up this question. So what are some of the training opportunities, if you've had any thus far? I know that, again, it's been a little bit of a shorter time.
Yeah, so I think, kind of we mentioned earlier, the leadership development program. I start mine in next week or 2 weeks. So I'm looking forward to that. Just kind of going through some of the prep materials so far. It just looks like a wonderful opportunity to meet people from other agencies. Internally, one of the best classes or trainings I've had so far was specifically for Pathways, for the Pathways program, but it was a whole networking class. And, many of us are like, oh, we've networked already. We know exactly what we're doing. But I think the best part about that training was that I was in a group with a lot of other people that were in really similar points in life with me. And I was able to kind of informally chat with them while we were on the Zoom. And then a handful of them I have standing calendar invites with now, and we touch base every week or every other week and just kind of update each other on what's going on. Not all of them are PMFs, some of them are interns, some of them are recent grads. And so we're all able to kind of just cheer each other on via Zoom whenever we get the chance. And that's made such an impact, in my time so far, because I have those like informal cheerleaders that are also people that are trying to start their career. And so for me, that's been the best training so far. It's one that I kind of signed up for very last minute, but you never know how those couple hour Zooms are going to impact, your coworkers and how it's going to help the rest of your time. So that's kind of a short overview there.
I don't really have anything. I did not get my stuff together to get into the LDP class that starts soon. So I'll be in the next cohort whenever that happens. But yeah, I don't really have anything else so far.
There's going to be plenty of opportunity for you, that's for sure. All right, I think Shaheen's going to ask our next question here.
Yeah, so what was your guys' experience with teleworking as a PMF? And do you guys have any tips to navigate the program virtually? Because that's kind of the reality of things moving forward. So maybe getting acclimated to CMS and collaborating with others. What has your experience been around that? Maybe we can start with Douglas.
So when I started, it was in May of 2020. So at that point, I think pretty much every federal agency had sent everyone to do telework, unless you needed to be in the office for some very specific reason. I guess in terms of acclimating, so when I started, CMS sent me everything I needed, computer, phone, they had your IT support. I know too, if you're teleworking now, a lot of times you can also request additional materials like, oh, if you need another monitor, or even I think you can get 2 monitors now, which is nice. So if you're a person who enjoys like a multiple setup, obviously you can customize it a bit. I think one of probably the more difficult things, obviously, is you're not going to see your coworkers in the hall if you're teleworking. So you have to really make a little bit of more of an effort to, reach out to them or even chat with them informally. And I think that's not just for government. I think that's for any job where you're going to be teleworking now. But it's a nice experience. I think a benefit too is a lot of times you don't necessarily even have to be in the Washington, D.C. area, depending on your job. Obviously, that will depend on what you work out with your supervisor, but you may be able to work outside that in a place that, if you prefer to work in Missouri or Mississippi or wherever you live, may not require relocating, which is a nice benefit. It gives you more flexibility in terms of personal life.
Great. Abby, how about you?
Yeah, so all of my jobs from, I guess, while I was in grad school were remote, and that's just because I graduated undergrad right into the pandemic. And so for me, I've never really known anything that different than fully remote teleworking. And I think the hardest part, is kind of touched on. It's hard to make those connections with your coworkers. And so the thing that's been most helpful for me is, scheduling regular check-ins or just finding ways to chat with people on my team or my supervisor or other people in the program. It's hard to make friends or work friends when you're not, having lunch together or, walking from meeting to meeting together. And so finding ways to kind of have that same camaraderie, but over Zoom is really, really important. And then I think the other thing for me is just been having a good kind of like home workspace. I live in an apartment with a roommate and a dog, and things get crazy here sometimes. So it's been really important to set up, a desk and a workspace that's mine, that I can sit down and get my work done, be free from distractions, and kind of model that I have a desk sort of cubicle situation, and just making sure that I have a place I can get my work done so I can separate work from home life, and then just trying to make everything feel as natural, like as in an office as possible without ever leaving my apartment.
Wonderful. Maya, how about you?
Yeah, so to Douglas's point, I am remote outstationed. So I live in Houston. That was where I have lived, before I became a fellow. And my boss was super open. She was like, we don't know where you're gonna land at the end of your 2 years. So even though I support the Baltimore office, I get to work remotely outstationed. And so that has been really convenient for me and really nice. And I appreciate the flexibility. I would definitely say, one of the biggest things for me is kind of learning how my team communicates. So we have several different channels that we can use to chat or call. And so just figuring out what works best for whom, and how to get a hold of people, because obviously I was working in the hospital during the pandemic, so I was just walking to people's offices and being like, hey, what's about this, what about this? And so for me, that's been a bigger transition than I think other people made earlier. But really just figuring out how people work has been the most helpful. And then I do try to schedule, as Abby said, kind of some coffee chats, or hey, I'd love to chat with you. you know you miss those informal times talking, um, when you would have gone to get coffee together, or you would have walked together to a meeting. And so not having everything be a one to, this is my one-on-one, this is my touch base with my boss, like having some more time for informal communication, I think is really helpful as well.
All right, excellent. Thank you for all of your answers. So we do have a couple of last questions here, and I'm going to go ahead and ask that, and then we're going to get right into the more specific questions that we have for our panelist members in the question and answer box. So to sort of wrap up our panelist questions, we want to ask, how is or was your overall experience as a PMF? And if you have any additional notes or advice that you would like to offer our audience today.
I'm guessing we're going in the same order, so I'll jump in.
Sorry, go ahead, Abby.
You're good. I think overall so far, I have just absolutely loved my experience. I know I'm only a couple months in, but everyone that I've talked to, whether they be previous PMFs or people that I'm currently working with, have just talked about how this program was such a great kickstart for their career. Actually, someone I went to undergrad with was a PMF at a totally different agency, but he was really helpful in kind of getting me involved in the process and just seeing how it helped him then move on to his career. And so I think it's a great experience. There's always something new and there's always something, added on, and there's always something to build upon. But for me, I'm just very grateful for the opportunity, and it's helped kickstart that career in public service, which is exactly where I want to be for my career. And it really helped me feel like my master's degree was getting put to good use right after graduation, since I started like 2 weeks after I graduated. And so it's kind of one of those full circle moments where everything I learned in school, I'm now able to apply in a career, and then learning new things to apply in, further careers. So I would highly recommend the program if you're looking for a career in public service, or even if you're just curious about one.
Thanks, Abby. All right, Maya, what about your experience so far?
Yeah, mine's been great. I have also had nothing but, everybody's happy, everybody's excited to meet you. I would say that, for me, it's kind of similar because it's a 2-year fellowship, and the goal of the program is to just like learn as much as you can and get as much exposure. I've really been kind of obnoxious probably to my team to using the same kind of, I'm a graduate student, like I want to jump in on this thing, teach me this thing. And so because you're in like the PMF program is another specific kind of program like that, with the mission being to get all these new experiences. I've really tried, and I will keep trying to leverage that to the fullest extent, right? Like, oh, I'm only here for a short amount of time. I'd love to get in on this project. Or even if I am not going to be working on that, I'd love to listen into this meeting, or I'd love to listen into this webinar, and really leveraging that as much as I can. And so, yeah, it's been really great. And everybody that I tell, I just say, you don't have to pay to apply. Like, there's no harm in applying. So just apply. And I had because it's so competitive, I had zero expectation that I would get it, which is kind of how I think everybody is. But, they are looking for a very diverse set of people. And so there's no reason to kind of not throw your hat in the ring.
Thanks so much, Maya. All right, last but not least, we have Douglas.
Yeah, I mean, I think just to echo what everyone else said, it's a really good experience. I think coming in as a PMF, you also have a little bit more flexibility, not just to do, work you're assigned, but also, to offer up, some other ideas. People seem, I think, maybe even a little more open because they know you're here for a couple of years. So basically, I think the limit on what you do is kind of based on your own personal ambition or where you want to go with with your career. And I guess related to that, it's nice. You get to talk with people from around the agency. If you do your rotation internally, you're getting exposure to a whole new office and a whole bunch of different people. And then within CMS as a whole, if you look at a lot of the leadership, so your managers or center directors or deputy directors, a lot of them were from the PMF program. I don't have a percentage, but I would say it's at least probably more than half of the people, maybe a little bit higher. And so I think it's a really good, place to be, because people understand what the program is about and are willing, I think, to help you along the way to where you want to go.
I think you make an excellent point. So that is definitely one of the other greatest perks of the PMF program here at CMS, is the fact that we have so many folks that are in senior leadership that were all at some point either a presidential management fellow or formerly known as a presidential management intern. So the program actually used to be called PMI versus PMF for those folks that were in this program, over 2 decades ago. So that's a wonderful point to make. Thank you all for your feedback on all these questions and answering them so deliberately. I think that you've shared such wisdom and knowledge with our audience today. And I definitely hope that our audience was able to take in a lot of that information. So I do have a couple of follow-up questions, I should say, from some of our guests here. But before I jump right into that, I do want to mention the fact that the application period to be a 2023 PMF finalist is going to be open essentially right around the corner. So I think Marla actually posted in the chat the application open dates So they're going to run from September 13th to September 27th. So literally they're starting off next week. So you want to make sure that you're geared up and ready to do that. Now, there is a little bit of a difference this year, just in case you talk to other folks in previous years that have applied to this program. So this year they are starting this announcement period way earlier. Typically does start sometime in October, but this year we are doing it in September. So again, make sure you go to usajobs.gov if you want to apply to be a PMF finalist. The other thing that's going to be a tad bit different this year is in previous years, we've actually had our finalist lists issued sometime around the week of Thanksgiving. Now, this year, they're actually going to be issued sometime in February, and there is a fully sort of embedded timeline associated with the link that has been provided to you in the chat box. So just make sure you go ahead, check that out. It's very specific in terms of what the process is going to look like this year. But again, just a quick reminder of, first you apply as, to be a PMF finalist, then hopefully you get vetted as a PMF finalist closer to that February timeframe. And then you'll be able to apply to all the different agencies that participate in the Presidential Management Fellows Program within an internal talent management system, and then hopefully start getting selected for positions and finally transition into what we call Presidential Management Fellows. So a lot of knowledge there, again, a lot of information. Just make sure you check out that link and it will have a comprehensive overview of what that whole process looks like. All right, so jumping into our specific questions that we would like to be answered live. So Maya, the first question is for you. Your question is, how does your background as a clinical healthcare professional serve you in your work at CMS?
Yeah, I think this is, so from my experience, there's there's clinicians in several different kind of roles and parts of CMS. So my understanding is there's, definitely clinicians kind of on the, should we pay for 6 sessions a year or 8 sessions a year for like this specific medical condition, kind of looking at the evidence and, assessing that from a clinical standpoint. I'm on the more of the like broader policy side, which is really what I was looking to transition into. And so for me, I think it's, having the experience as a clinical staff. So I was a pediatric ICU nurse, and so I'm interested in pediatrics, but because I've worked in healthcare, you have a different kind of view of how the healthcare system works, right? And so for me, I'm able to kind of draw on that experience and say, I know, because a lot of times when people talk about problems, it's really at the 30,000 foot view. And that's helpful in some cases, but it's also really helpful at times when you're telling a story to be like, let me tell you about this one person. Let me tell you about this one story, this one patient that I encountered. And so I would say with the PMF specifically, there aren't a lot of clinicians that I've come across in PMF. And we're not always a natural fit. And so for me, I'm happy to talk more about this if anybody wants to talk about this offline, but kind of crafting my transferable skill set was a different thing that I, developed as I became a PMF. For example, I would always say in interviews, I don't feel like I really need like a project management, a PMP certification, because nurses are project managers. Like every 12-hour shift, I had this list of things I needed to do that, priority was constantly changing. I was constantly shuffling, and adding context into those transferable skills is really important as well. So I would definitely encourage any clinicians to apply. I also saw a question in the chat about people still continuing to work. I can't speak to the specifics of how that works, but I do know clinicians, not fellows specifically, who are both doctors and nurses who continue to work per diem or on the weekends, or continue to work in a clinical setting as well. And so CMS really appreciates my clinical background, and I feel like I'm able to have a lot of conversations with providers, nurses, doctors, both within and outside of CMS, because we speak kind of the same language. And so that's been really helpful.
Thanks so much, Maya. And that's great that you also touched on sort of the clinician aspect of things. So to kind of dive a little bit deeper into that too, I think I saw that earlier as well. So typically, our PMFs work more so on a full-time basis, cover their 40-hour weeks, et cetera. However, if there is an additional role or job that they would like to partake in, this particular field included, we do have an ethics office that they would have to run that additional job through to be able to make sure there's no conflict of interest, et cetera. So there is a process associated with that as well, whether or not you would be approved to continue that kind of work. All right, we do have one more question, and in the interest of time, I'm going to read this very quickly. So Abby, this question is for you. Can you mention a couple of Facebook groups or LinkedIn groups that you can share with everyone?
Yeah, so I think most of the ones we have are very specific to the class of 2022. So if you were to become a finalist, there would probably be one made then for your class. However, I don't know if anyone is located in DC or in the DC area or is looking to relocate there. But there is one called Presidential Management Fellows DC Metro Area that does allow prospective PMFs. So I was added to that one before I even went through my application process. So that would be a good one to join if you are looking to be in the DC area or already are. Otherwise, everything was kind of created after the fact once finalists were announced. And then we kind of just spawned off from there. So I don't have any other specific ones to share that I know of. Great.
Thanks so much, Abby. All right, we do have one last question in the Q&A, and I know we've touched on this quite a bit, throughout all three of our panelist members here. But Douglas, I'm going to ask you to name any type of specific examples of projects that you worked on within the PMF program.
Yeah, I think one that we worked on recently, it was related to basically how the workforce is made up. So that data is all public, but it's in like a 100-page report, which is difficult for anyone to understand unless you're willing to go through 100 pages. So we built a dashboard in Tableau, which is like a business intelligence software, which allows agency leaders basically to go in and look at like, okay, at each pay level, like what percentage of the employees are women, what percentage are Black or white, or any other group, and a bunch of different metrics, which allow them basically to see what is the makeup of our workforce, which they could then use that information to decide if they needed to implement policies to make the workforce more diverse, if there's issues they want to look into more, or if there's certain areas where they think they're really succeeding. So that went out, I believe it was last year, and then it's updated regularly so they can also track it over time. To kind of give you the most up-to-date information.
Great, thanks so much for sharing that example. All right, so before I kick it back to Marla, I just want to say thank you so much for joining us today. Thank you to our panelist members as well, and to Shaheen for co-presenting. I think we've, shared quite a bit of information with everyone to be able to process today, and definitely hope that, you're looking into the Presidential Management Fellows Program. Obviously, we would love to have as many folks here at CMS as a whole, but, the PMF program across all the agencies is absolutely wonderful. So I definitely encourage everyone to look a bit more further into it. So thank you again to our audience and to our panelist members and Shaheen as well. Marla, go ahead and kick it back off to you.
All right, thank you, everyone. I will echo Natalia's thanks to everyone. I think I love to hear firsthand accounts, right? I think the audience our listeners get the most out of it from hearing directly from our participants. So thank you all again. I will mention, we did have a question asking if any of the panelists would share their emails. So I just want to put it out there. It is not required, but if you're willing or want to share your email address with our audience members, feel free to throw it in the chat and make it available for everyone to see. I do want to mention before we close out, obviously the PMF program is fantastic. We encourage everybody that's eligible to apply. We do also host other tiers of the Pathways programs at CMS. The Recent Graduates program is one. So many people that are eligible for the PMF program are also eligible for the Recent Graduates program. We do have other webinars, specifically targeted for recent graduate opportunities. However, I did just want to mention over the course of the upcoming semester, so September, October, November, we will have several recent graduate postings out there as well. So what that means logistically is while you are applying to the PMF program and waiting to hear if you are going to become a finalist, you are also welcome to apply to our recent graduate opportunities as well, if you meet the eligibility requirements. So I'll have my colleague, actually Shaheen, I see that Sean had to drop. So if you could grab the Pathways website and just post that in the chat. We will be updating our website shortly. And on that update, probably by next week, you will see the full posting schedule of when we plan to post our Pathways opportunities. So that again will be updated next week. Keep an eye out for that. And again, feel free to apply to the recent graduate opportunities in addition to applying to the PMF program. If for some reason you're not chosen as a PMF finalist, you'll still have those opportunities at CMS to, I'll call it, fall back on. So with that, again, I want to echo my thanks to our presenters, to our panelists, to my human resource colleagues for monitoring the Q&A box, and certainly everybody on the line for tuning in. We hope you got a lot out of the webinar today. I know it was a lot of information. Again, just a reminder that we will be following up with an email to all registered attendees, which will include the slide deck that we used the first half of the webinar. Also a reminder that the recording of this webinar will be posted to our YouTube channel, which is in the chat box during the first week in October. And the last reminder is we do have other webinars coming up. So we host this webinar series every first and third Wednesday. Today's Wednesday. First and third Wednesday at 1 p.m. Eastern Standard Time. Our next webinar is going to be September 21st. And the topic is building your personal brand through LinkedIn. So we encourage everybody to register for that webinar and any of our other webinars that you might be interested in coming up. So again, we thank you for your participation today. Any last minute questions that are coming in, we will answer through the Q&A box. And good day to everyone. Thank you so much.
Hey, Marla, I actually have a quick comment. I think that I'm not sure if everyone saw the information in the chat box, because I think we're only allowed to post to hosts and panelists. So we may have to ask you to copy some of that information to everyone.
Got it. I will. Thank you so much. I will do that now. So anybody looking for the panelists' email addresses, I will post that right now to everyone. Thanks for that.
Yep. And then also the recent graduate schedule, the Pathways page too.
Perfect.
Thank you.
Thank you. Thank you, Isaac. For anybody still on the line, we are going to launch a poll, which I totally forgot to launch.
Yeah, I was just asking. I sent you a couple messages.
Sorry about that. So for anybody still on the line, we just launched a poll. Really interested, even though I forgot, really interested in your feedback. We are continually trying to make our recruitment efforts and outreach efforts more effective and more targeted to our audience. So if you have any feedback for us, please fill out the poll. And the last question gives you an email address to email us with any future ideas. So thank you again. Thank you, Isaac. Appreciate that.
My pleasure.
Thanks everyone for sticking in there. Thanks for responding to the poll. And it looks like we covered all the Q&A. So at this time we will disconnect. Thank you so much. Mhm.
All right. Have a great evening.
Thanks, Isaac.